Hello, I bring you a coronavirus update for April 14th, 2020. My name is Heerak Christian Kim. I'm an independent candidate for US Congress, bringing you a daily coronavirus update so that your family and you can survive. Today's theme is what's happening to the United States. And we're going to study the current situation and look to the future of the United States of America in light of coronavirus. So stay tuned. There's a lot of important information that you can use, and this will be a very interesting program for you. Unfortunately, we saw a steep rise in coronavirus death today. In the last 24-hour period, we had 2,377 COVID-19 deaths. That's a rise from yesterday of about 900 deaths, because yesterday, and you can see this program from yesterday, we had around 1,500 deaths. So Easter Sunday, we had about 1,500 deaths. And on Easter Monday, we had about 1,500 deaths. But today, we have nearly 2,400 deaths, a rise in 900. Maybe God gave us a break for Easter Sunday and for Easter Monday because they celebrate the resurrection of Jesus Christ. Now that Easter Sunday is over and Easter Monday is over, maybe God's continuing the rise again. Since if God is in control and He's the creator and He controls what happens to all living organisms, including the virus, and immune response to the virus, because our cells are living organisms, maybe this is the direction that God wants to take things, unfortunately. As I've commented before in previous programs, and you could go back to previous shows of COVID-19 update by Heerak, I have kind of described the plagues in the Bible and have illustrated how COVID-19 can fit into the biblical narrative of plagues. So you can see that episode if you like. I've talked about how Abraham being tested in his faith in the book of Genesis, and have discussed COVID-19 in light of that. There are a lot of exciting and interesting shows that kind of bring about spiritual interpretation of COVID-19. And there are other shows that focus on scientific interpretation. There's other shows that describe institutions and how institutions relate to COVID-19. Subscribe to this YouTube channel so that you can become wise regarding COVID-19 and how it relates to every aspect of life. As you can see, I have Georgetown MedStar Hospital hat here. As I've shared, I'm a Master of Science in Nursing student at Georgetown, doing Master of Science in Nursing with specialization in clinical nurse leader. I've done my nursing clinicals at Georgetown Hospital, MedStar Hospital, and I've done clinical nursing work at George Washington University Hospital in Washington, D.C., and also at National Children's Hospital in Washington, D.C., Innova Fairfax Hospital in Fairfax County, and the Adventist Hospital in Shady Grove in Maryland. I have worked with baby delivery, cesarean sections, taking care of women who have given cesarean section or vaginal birth, delivery of babies. And so I, as a Master of Science in Nursing student to graduate in 2020, bring you a professional perspective on COVID-19 as a from the perspective of nursing studies or nursing science. So tune in, and there are a lot of episodes where I talked about perspectives of COVID-19 from a nursing science dimension. And so tune in and check those previous episodes out. So subscribe to this YouTube channel. You will find much helpful information that you cannot find anywhere else in CNN, Fox News, New York Times, Washington Post. So check back every day. So unfortunately, in 24 hours, we had around 2,400 deaths, exactly 2,377 deaths. So yesterday, the total death toll in United States of America was 23,604. Today, the total stands at 25,981. And confirmed cases remain the same, relatively, rising around 30,000. So yesterday we had 581,679. Today we are at 608,377. But the disturbing thing is that we have a sharp rise in COVID-19 deaths, even from last week. Because during Holy Week, we had around 2,000 people dying every day. Holy Week is known as a Passion Week. It's the week when Jesus Christ suffered. So it's the period between Palm Sunday and Easter Sunday. We had about 2,000 deaths average per day. So in 5 days, we had 10,000 deaths. So most of the 25,981 total deaths in the United States came from last week. But we see that in the last 24 hours, there has been a steep, sharp rise. So God has given us a break on Easter Sunday and Easter Monday, where the death was reduced from 2,000 to about 1,500 for 2 days, Easter Sunday, Easter Monday. Now we see a sharp rise. We're going to see tomorrow if this is the new reality for COVID-19 deaths. Let's see if tomorrow, 24 hours from now, we have about 2,400 or 2,400 deaths, that we may be able to say that that's the new rate. So disturbing things are happening in the United States. It seems like things are getting worse in the United States. We're entering critical moment, and we're getting worse and worse and worse in terms of COVID-19. Now, so today we're going to talk a lot about United States, but before we do that, in order to compare, because generally you want to compare your situation with situations of others in order to understand where you are. And so in order to properly understand where United States is, we need to see what the situation in other countries are. So I bring you today top 5 COVID-19 cases from Europe. Spain now is number 1 at 174,060 deaths. So Italy is no longer number 1, Spain is number 1. The total death in Spain is 18,255. So the death rate in Spain is rising at average of around 500 to 600 deaths per day. Obviously, Spain is much smaller as a country than the United States. We have around 330 million people. And Spain is about 1/6 the size of the United States. Now, Italy is number 2 with 162,488 cases, and their total death is at 21,067. Germany is at third place with 132,210 COVID-19 cases, but look at the death rate. They only have 3,495 deaths. China's total death is about that number from November to now. And yesterday's episode, I talked about how maybe racial purity, genetic purity in terms of being a single race may play a role in helping you not to die from coronavirus. So we see on TV mild cases of coronavirus, people who have coronavirus, but their case is relatively mild. And I have postulated, I have hypothesized that perhaps if you are racially pure breed, you know how you have pure breed horses and pure breed dogs, and some scientists treat human beings, Homo sapiens, as an animal as well, at least in scientific terms or biology terms. And so pure breed human beings, like pure breed Chinese, pure breed Africans, like in Nigeria or Sierra Leone, or pure breed white people, Germany, which calls itself the Aryan race, at least during the Third Reich, that's what it did. And Scandinavian areas, which tend to be racially kind of homogenous. The Russians, you have the Slavic people who are ethnically kind of homogenous, and we see that death rate is fairly low. South Korea, where I came from for 5,000 years, we have a genetically, quote, pure breed, Koreans kind of marrying just Koreans for 5,000 years. And we see that in these, quote, pure breed countries, whether it's in Africa with Black people, China and Korea with Asian people, or Germany, Russia, and Scandinavia with white people, pure breed Homo sapiens seem to have less deaths. I have challenged the scientific community to research this on yesterday's episode. So if you haven't seen yesterday's episode, go and see it. And I've argued that we need to study all dimensions in order to treat COVID-19. So if it is true that it's people with many different races mixed into their DNA that makes them more vulnerable, then we need to figure out drug treatments or different types of treatments that will address that issue. Now, if you want to be politically correct and not research this, then you may not find the cure or the treatment. So my argument is it's better to save lives. We have to research every dimension of COVID-19, including the relationship between race and getting COVID-19 and the virulence of COVID-19, meaning among those people who have it, do people who are quote pure breed suffer less or have mild symptoms, or is that not the case? So we approach research with an open mind and let the research dictate the result. So that's something that I've challenged. And look at the data. I mean, these are all European countries, but pure breed Germany, which is predominantly pure breed, they have a lot of Turkish people, but Turkish people marry Turkish people in Germany, right? And Germans marry Germans. So even if there are different races, you can have pure breed races within a country, or you could have different races mixing through intermarriage and having interracial children. This is not a commentary on whether interracial marriage is good or bad. That's not the point here. The point is, does it impact survival rates for COVID-19 if you are multiracial or not? Because we need to figure out how we can help you, how to cure you or how to treat you of COVID-19. So if we find out through research, scientific research, that multiracial people are more vulnerable to COVID-19, then we need to figure out medical treatment and nursing interventions to meet that challenge. So we're talking about scientific ways of saving lives. So we need to ask these questions. So go back to yesterday's episode. If you're interested, watch that whole show, and there's more discussion on that. Now let's go to France. France has about 131,361 cases as of today, similar to Germany, but look at the number of deaths. 15,748 deaths. And we know that, like in Paris, there's a lot of interracial marriage, a lot of races mixing. So at least based on the statistics we have here, it may be that this theory may be correct. Obviously, I'm going to leave it up to you scientists to do genetics research, DNA research, to figure out, and also social scientific research, to figure out whether that's the case. So you scientists out there in Spain, Italy, Germany, France, you do your research, find out whether that's true or not. United Kingdom has 94,845 cases, but look at the deaths, 12,129. And we know there's a lot of interracial marriage in Edinburgh, Scotland, and in London, England, and in places like Birmingham, England. So it'll be interesting to see if the pattern is true, and that multiracial individuals in these cities are the ones who are dying in large numbers. So racial death research can be helpful in informing scientists of the direction that they should go in terms of genetics research, research about viruses, in order, obviously, to find how to save people who have COVID-19. Because if it's targeting multiracial people, people who have more than one race in their blood, or a lot of races in their blood, then we need to find a way to cure them or treat them, because obviously that becomes an important factor. We're going to go now to United States. United States is in serious trouble. And there are 3 articles that prove that. First article is social distancing due to coronavirus could last into 2022, Harvard study finds. So Harvard University has School of Public Health. It's one of the best schools of public health in the country, perhaps in the world. People from all over the world come to Harvard to study public health. And public health is exactly dealing with pandemics, as you know. Nursing, we treat individual patients. So focus of nursing research is how to treat individual patients. Focus of School of Medicine that produces doctors is similar, how to treat individual patients. Now, School of Public Health deals with how to deal with pandemics, how to deal with health issues relating to populations. So when we talk about virus and pandemic, School of Public Health is probably the most important school for helping to solve these problems. Obviously, in the area of nursing, we have an area called public health nursing. And as you know, I'm Master of Science and Nursing student, so I could give you some helpful information that will help you to become more erudite and knowledgeable about these things. So subscribe to the YouTube channel so that you can become more aware of what's going on and issues that are involved in COVID-19. Now, I am having public health nursing clinical right now. So as part of that, what I do is I work with Arlington County Department of Public Health. So my clinical involves going to Arlington County Public School System, working with the nurses there uh, dealing with students. So I've worked in different schools, middle schools, elementary schools, and high schools in Arlington County in the context of my training in public health nursing. So in the nursing field, there is area of research, nursing research that focus on public health nursing. So some people say it has a crossover between School of Nursing and School of Public Health. And so I've been working with leaders in Arlington County who are top people in Arlington County dealing with public health, nursing, and school nursing. And so that's an exciting thing. Obviously, once COVID-19 hit, Arlington County did not want, they needed to focus on COVID-19 crisis in Arlington, and death rate in Arlington is beginning to rise. So kind of direction has shifted a little bit, and also all the schools are closed. So that kind of makes it difficult for us to work with school nurses right now. But anyhow, so public health nursing deals with coronavirus cases. And right now, school nurses who work in Arlington County public schools, they have all been channeled into public health nursing, a public health department in Arlington County, trying to reduce spread of COVID-19 in Arlington County. So the nurses in schools are working hard to help you. I'm in Arlington right now. I live near Columbia Pike, where a lot of Hispanics live. So my neighbors I have a lot of Hispanic neighbors, Arabic neighbors, so there's a lot that is going on now in public health sector. So experts in Harvard University School of Public Health are predicting that this COVID-19 will continue until year 2022. Now, for those of you who have been watching my show religiously every day, you know that from the very beginning of my show, I have told you that COVID-19 will continue 18 months or more, continuously without stop. And I disagreed with Dr. Fauci, if you see what episode from a few weeks ago, where he said COVID-19 is seasonal. It's like a flu. So we have a flu season, starts in the fall, ends in spring, then starts back up in the fall, and then ends in the spring, and you get flu shot every year because flu virus mutates. So it's not the same every year, so you gotta get flu shot every year. So the vaccine this year is not the same as vaccine next year because flu viruses mutate, change. And I shared that I had a flu shot, but I still got the flu. So even flu vaccines are not 100% foolproof. You can still get it. Now, unfortunately with COVID-19, we do not have a vaccine. And they said the earliest time we're going to develop vaccine is probably in 18 months. And they are highly doubtful that we'll be able to develop a vaccine in 18 months because COVID-19 virus is so complex. And so that is a serious problem. So Harvard School of Public Health is saying that unless we have a virus, people are going to continue to die from COVID-19 until year 2020. At least, meaning people can keep dying past 2020. But Harvard University is hoping the vaccine will be developed by 2020, so they have set that date as a date until when the schools need to close and social distancing need to continue. And so that's the date they have set because they're thinking that in 18 months we should be able to come up with a vaccine, although nobody is sure. It may not happen. Going back to what I was saying, Dr. Fauci was with the school of thought that said this may be seasonal. like the flu. So it starts in the fall, stops in spring. Summer, it's okay. And then it starts back up in fall. Then it ends in spring. Since I had aired that episode a few weeks ago, Dr. Fauci has kind of revised his position. So he's not saying that it's like a flu, that it's going to end in summer. So Dr. Fauci's position has changed. Maybe he saw my show. Maybe he's kind of done research on his own, talked to other experts, because there are other experts who believe that COVID-19 will continue continuously. And I have held to that position from the very beginning, and you could check all the previous episodes. So I feel vindicated because I'm right, and I've been consistently right in this show, and that's why you should keep watching this show, because I've been right, and I bring you information that you can use, that many of which you cannot find anywhere else, especially because I bring a lot of extra information into it and give you interpretation. And that's the kind of thing that consultants do, right? Consultants charge hundreds, thousands, tens of $1,000s, for companies maybe more than that, to give information. Information is the new currency of the 21st century. So the gold, the most valuable thing in 21st century is information, more valuable than gold or oil or even technology. I mean, technology is based on information, but information can spread technology faster if you have that information. So information itself is the commodity, is the most valuable thing. And that's what I bring you. That's why you should watch my show religiously, because I bring you top of the line, creme de la creme information that you can use. And that goes for all your experts as well, because as you know, I'm an expert of Jewish studies, certified expert of Jewish studies. I am a licensed expert in education. I'm licensed teacher in Washington, D.C., state of Virginia, state of South Carolina, state of Tennessee, state of Alabama, in all subjects, math, science, social studies, English, reading, special education, English as second language. And in Washington, D.C., I have an administrator's license, so I could be a principal or an assistant principal there. And so I bring a perspective as an expert of Jewish studies and as an expert, certified expert of education, and as an expert of health studies and nursing from experience, as well as from book knowledge. So that's why I bring you a insightful information that is a valuable currency that you do not want to miss, that you can use, even if you're experts in any of the fields that I discussed. My show will help you advance your own professional goals and your research objectives. So watch religiously. Now, so Harvard University is saying that unless vaccine is developed, and they're hoping it will be developed in about 18 months, from now until year 2022, Harvard is saying we have to social distance ourselves and we have to keep the schools closed. Because if we do not, people are going to get infected and they're going to die. They're going to die. Now, just because time is passing, let's say 10 years from now, if we do not have a vaccine, and if COVID-19 did not mutate in a harmless direction, if it stays the same as it is now, in 10 years from now, it will be killing Americans at the same rate. 2,000 people per day. If there is no social distancing. Because same number of people who have the same genetic makeup today will have the same genetic makeup 10 years from now. So if the people with the same genetic makeup are dying now, people with the same genetic makeup 10 years from now will die from the same virus that is COVID-19 that's killing people now. Do you understand what I'm saying? Unless you change genetically, you're going to die from this. So let's say you survive year 2020 without getting infected from COVID-19 because you're staying at home and every time you go outside, you wear a mask. They do not have a vaccine in year 2021. They didn't develop it. Let's say. There's high chance they won't because it takes at least 18 months to develop a vaccine. In year 2021, let's say Easter next year. Next year, Easter, in year 2021, 1 year from now, you walk outside, you forget to wear a mask, or your mask has a hole because you've worn it so many times and you did not know about it. And you see a friend that you haven't seen in a while and you get excited, forget that, COVID-19 is out there, and you go close and talk to your friend, and your friend, unbeknownst to you, has COVID-19, which is not showing symptoms. So he didn't know that he had it. So he's excited. So he's like shaking your hand, and you shake his hand, and you forget about it, and you quickly wash your hand. But while you're walking to the bathroom to wash your hand, you might have touched your eyes, your nose, your mouth, and your friend might have said things, and the virus might have entered through the hole in your mask because you've been wearing that mask for so many times. You did not know there was a hole, but there was. You get infected from COVID-19. You can die next year around Easter. Do you see what I'm saying? And that goes for every year after that if there's no vaccine. And if COVID-19 is still circulating. So let's say you survive COVID-19 in year 2020, and you survive COVID-19 in 2021, but in year 2022, you forgot or made a mistake, because human beings make a mistake all the time, and you forgot to secure your mask very well, and some kid ran by you and said something, and he was like a 13-year-old kid, did not know what he was really doing, but he had COVID-19, he spread it to you. Anything could happen, right? Then you can die in year 2022. Do you see what I'm saying? Let's say you survive year 2022 and you survive year 2023. And if COVID-19 is circulating and there's no vaccine, you can die in year 2025. Yes, that can happen. Don't think that this is just going to go away. Obviously, God could end this now, like snap of the finger. God could say, all you COVID-19 viruses die now, then it will die and pandemic will cease. But obviously, you got to make God happy, and obviously, God's not happy. How do we know God's not happy? Because 22,400 Americans are dying every day now from COVID-19. That's the proof that God is not happy. And obviously, if God's in control of that as well. God could end it, but he refused to because he's not happy with you. I don't want to be very, very harsh, but let's face it. God is God. You read the Bible. In order to have him bless you, you have to make him happy, right? You just read from Genesis to Revelation. That's the common theme. You make God happy by doing what he wants. He blesses you. You make God angry or wrathful or vindictive because you do not do what God wants you to do. God punishes you, right? When Adam ate of the tree of the knowledge of good and evil with the fruit that Eve gave him, what happened? God kept his promise that he would surely die if he ate that fruit. God kept that promise, and Abraham died, right? That's how death entered the world. And so obviously we need to look at the spiritual dimension, because obviously medicine is not working, science is not working, it's not saving lives, right? And science may not develop a vaccine for the next 2 years. It may not develop a vaccine for the next 10 years. We just don't know. And let me also tell you another scenario that you may not have been thinking about. And that is this. Let's say they develop a vaccine based on COVID-19 from year 2020 Easter time, 18 months from now. And they discover this vaccine and they say it works. And then they give this vaccine to everybody in year 2022, but COVID-19 changed. It's kind of like flu changes every year. So you have to change the vaccine every year. So let's say COVID-19 changes in year 2023. Then none of the people who got vaccine that works for COVID-19 for 2020 will be protected. So 2 years of research will go down the drain if COVID-19 changes. And virus changes all the time because virus is a living organism. It evolves. Do you see your child who's 2 years old now? Do you think your child who's 2 years old now will be the same height 2 years from now? No. Your child will change. Height may get fat. Living organisms change, and COVID-19 can change as well. And so we have proof from history of things like this happening. And you could study the history of viruses, and you will see that I'm telling the truth on this. So these are all the things that can happen. So it is possible that hundreds of millions of people will die from COVID-19 in the next few years. It's also possible a billion people could die. We don't know. We don't know. I mean, God could end this right now if he wants to, but he's not, apparently, because people are dying. And, you know, hundreds of million, over a billion people could die in the next several years. It's possible. Ask any scientist, any mathematician who can calculate exponential death will tell you this is absolutely true, that this is a possibility. I'm not saying it will happen, but it can happen. Now, let's go to the second article. It says Boston University is first to announce it may postpone opening the campus until January 2021. Obviously, Harvard University School of Public Health is not the only school doing research on this. The Boston University School of Public Health is also doing research. And in fact, it's common knowledge, if you do not develop a vaccine, people will die from the same virus if the virus continues, and January viruses continue. They're not just going to commit suicide. Human beings commit suicide. Viruses do not commit suicide. Have you seen a dog commit suicide? Have you seen a cat commit suicide? There is not a single case of a cat committing suicide recorded in history in the last 5,000 years. Not a single one cat. Only animal, if we were going to call human beings animal, that kills himself or herself is Homo sapien, human beings. No other animal kills itself. And virus is the same. It's not going to kill itself. And so, since viruses are not going to kill itself, they're going to try to survive. You can expect viruses to continue. Do you see what I'm saying? Now, so Boston University obviously is logically anticipating COVID-19 continuing now in the summer, continuing into the fall. So they know that even if cases decrease, let's say 500 people die every day instead of 2,000, you cannot open the campus, right? Can you open the campus with that? Because once you open the campus, you know how close dormitory is? I mean, everybody could get it. Every single undergraduate student or graduate student in the dormitory can get COVID if they go into the dormitory because it's highly concentrated. Most people have a roommate. They're going to, yeah, I mean, you know, so they're going to get COVID. So logically, Boston University is saying, we're going to just tell the students that we admitted in April people that we sent out letters to saying you're admitted to Boston U, just stay home. Don't come to Boston University in September. Stay home. We're going to teach you classes online through Zoom in the fall semester. Stay home with your parents. You can take courses online. So we're not going to open up our university campus because we don't want to bring thousands of students on campus and have all of them get COVID and die. We cannot have that in our hands. So Boston University being rational, right? Because Georgetown University, where I'm a graduate student now in nursing, I'm doing my Master of Science in Nursing, and I'm actually the vice president of graduate student government at Georgetown. We have like 9,000 graduate students, and I'm the vice president. I was elected vice president last year, March, so year 2019, March, in an election. And so I represent all the graduate students at Georgetown, not only in nursing school, but master's and PhD programs in the medical school, and MBA students in the business school, and School of Foreign Service, master's and doctoral students, graduate school students, School of Public Policy students, public health students, doing master's and doctorate. So there's about 9,000, and I am the vice president. I am their number 2 in command. So I'm wearing our official shirt here, just to be in the school spirit. Since we're talking about schools closing, I figure, I'll get into my Georgetown spirit, school spirit, and do this show. Now, so Boston University, which accepted master's students, PhD students, students to start their bachelor's program, are saying, you all stay home, just study from home. So because they have to start sending out stuff, right? If you have a son or daughter who started college in year 2019, that you know that when the admissions letters come, you put the deposit down, and that could range anywhere from $100 to $1,000 or more. And then they'll send you information about dormitory and meal plans at the cafeteria, and other information, right? And generally, you send back this information in May. Some schools require you send the deposit by May, and some schools actually require you to put the dormitory and food forms by May 1st. And so April is the month that schools have to decide what they're going to do for September, because they have to send out materials to you. That's what all the schools do. Harvard University, Yale University, University of Pennsylvania, where I did my bachelor's program, UCLA, where I did my doctoral work in history department. They all send out letters, and then they have to send out dormitory forms and cafeteria forms, because they have to plan all this stuff and organize which dorms will have which students. So it takes time. So they generally require these forms to be sent back by May or June, at the latest by probably July or August. Lazy schools may give you until August to do it, but most schools will require this information back by May 1st. And so right now, Boston University is the first university to say, hey, we're going to close until January, and they may continue closing it, because if they don't have vaccine or treatment and COVID-19 continues, then basically they have to close down for the spring semester 2021 as well. And so I actually sent out some tweets, and you could check out my tweet account, which is Heerak #4 Congress. So Heerak 4 Congress, but for my tweet account, it's Heerak, the #4 Congress. You will see that I've actually sent out tweets to colleges saying you should consider closing for year 2020 to year 2021, because COVID's not going to end. Now, that's just my suggestion to the colleges, because I'm a social leader. Obviously, I'm running for U.S. Congress in Virginia's 8th district, which is Arlington, Alexandria, Falls Church, and Fairfax County. So I am a leader in this area, and I'm hoping to be elected as a U.S. Congressman in the November 3rd, 2020 general elections in Virginia for U.S. Congress position to be a U.S. representative for Virginia 8th District. So I am a leader here, and I represent a certain political position or different political positions, and people who agree with that will vote for me. I hope you will vote for me because I represent a lot of good positions. And so I am a leader. I'm your leader, right? Arlington, Alexandria Falls Church, Fairfax County, whether I'm elected or not, I am your leader in the sense that I am a leader of Arlington, Alexandria Falls Church, Fairfax County. And if I become the U.S. Congressman in November 3rd, 2020, I become the leader, right? Right now, I'm a leader because there are other people running for U.S. Congress in Virginia's 8th District. So I represent certain political positions, which I hope will convince you and that you will vote for me, right? So I am a leader in Virginia's 8th District. There are a lot of police officers in Arlington Police Department, Alexandria Police Department, Fairfax Police Department, Falls Church Police Department who support me, who will vote for me. And you know who you are. And and that's not just the police department, fire department, Department of Public Health, school nurses, public school teachers, there are a lot of people who will vote for me. I'm hoping to get enough votes to win, obviously, that's my goal. But I am a leader, so I feel an obligation as a leader, a major leader in the state of Virginia, to encourage the colleges in the area to treat COVID-19 seriously so that they do not put students' lives in jeopardy. So let's say George Mason University sends out, oh, congratulations, you're accepted. Here's a dormitory form. Here's this form, that form. And students put deposit and they all plan to come. And then COVID-19 death is reduced to, let's say, 300 per day. And then George Mason brings students on campus and then thousands of students die. Then George Mason will be responsible, right? I'm trying to prevent these kind of things, massive deaths. And also I'm trying to help George Mason University because if they plan to open in September and they have to close at the last moment like August, or they may have to close in September because they have 100 students dying and now they have to send everybody back because they're dying from COVID-19, then it's going to cost them a lot of money too. So it's not, and it's going to be a lot of problem because students have to move and we don't have a vaccine yet. So it's probably safer to tell everybody that it will be online education just like now in fall semester 2020. If there's any changes that come, we will inform you. That's a better way to go. But I don't see colleges and universities in Virginia doing that, and that's the problem, right? Virginia's universities have been the last to send their students home because of COVID, not the last, but among the last. And that's a serious problem because I care about Virginia, I care about Arlington, Alexandria, Falls Church, and Fairfax County. I care about the colleges in Virginia. And that's why I've sent my tweets to all these colleges saying, consider closing for academic year 2020 to 21. Because I want to save them money. And also, I don't want them to become institutions that end up killing people because they're not taking precautions. And the way that colleges in Virginia dealt with COVID-19 in March is horrendous, horrendous. And colleges, presidents of colleges in Virginia should be ashamed of themselves for not taking necessary precautions and taking active steps. Harvard University closed down its university as soon as COVID started and sent all of its students back home. Not just US students, all the foreign students. All the students from China, Germany, France, Korea, they sent them home. They said, we're going to close all the dormitory. We don't want anybody in the dormitory because we don't want anybody to get sick with COVID and die. So they did the right thing. And I've been criticizing Georgetown University. Yes, I'm the vice president of Georgetown Graduate Student Government called GradGov. You could visit gradgov.com, gradgov.com, and go to Facebook page and see all the photos that I'm in. Because I'm the fun guy, so every time we have a event at GradGov, I am the fun guy. I'm trying to entertain everybody, and so there's a lot of photo of me, on GradGov Facebook. But anyway, yeah. So Harvard did the right thing. Georgetown University did not, and I've criticized Georgetown University in my tweets. You could go to my tweets from and see all the criticisms that I have offered to Georgetown, because Georgetown kept like 150 students in its dormitories, and some of those students got COVID-19 because they were in the dormitories, and then they were sent home with COVID-19. Can you imagine what happened when these Georgetown students got COVID at Georgetown University's dormitory? What happened to their states when they went back home? So let's say they're from Michigan. The COVID, I don't know if they're from Michigan because that information was private, but let's say they're from Michigan. So Georgetown University student, they kept like 150 students or more students there. They're using some lame excuse like, oh, people can't go home. What do you mean people can't go home? These are 17, 18-year-olds who came from home to study at Georgetown. Of course they can go home. See, sometimes Georgetown University does some stupid things. It's ridiculous. I don't know who made that policy. That person should be fired because I bet some of these Georgetown University students got COVID. They had to go home because they got COVID, right? So they're going home with whom? Father and mother who picked them up. What's going to happen to the father and mother? They will likely get COVID-19 because they have to pick them up. Now, if Georgetown University closed the dormitories down and like Harvard University did and made every undergraduate student from every country in the world go home, then they would not have had COVID. They would have gone home to Michigan without COVID. None of their family members' lives would be in danger. But because Georgetown University was so stupid, unlike Harvard University, they allowed some students to stay in Georgetown campus dormitory, some of whom ended up getting COVID-19. And then their parents came to pick them up, probably got infected with COVID-19. And then let's say they came from Detroit, Michigan. They go back there. Their father and mother is now infected. So they're infecting other people in that neighborhood. The Georgetown student who got COVID, who went back to whichever neighborhood he or she went back to, now he or she is spreading COVID all over that neighborhood. Do you see how one patient can create thousands of deaths through infection? And that's why Harvard University closed down all of its dormitories and sent every single undergraduate student home, because that is the way you stop the spread of a virus. One person gets it, that person can spread it and kill 1,000 people. And everybody who understands public health understands that. And so I've been protesting to Georgetown University, send all the students home before they get COVID, because what's going to happen? If they get COVID, you think Georgetown University is going to keep the students there? They're going to call the parents and say, oh, pick your student up. Your child has COVID. So mom and dad have to come and pick the child up who has COVID. They're going to be infected. Do you see what I'm saying? And so I care about people. That's why I'm running to be a U.S. congressman, because I think about things that you may not think about. You see what I mean? This is why you need to vote for me if you're in Arlington, Alexandria, Falls Church, and Fairfax County, because I am a leader who can save you and your children. But if Georgetown University listened to me, then there may be thousands of people in other states who may not be infected with COVID. You see what I'm saying? When you send people home after they get infected with COVID, you are sending someone to spread COVID in whichever neighborhood they're from. And that's why Georgetown should have done what Harvard did. And that's why I'm telling all the colleges, community colleges, which may have dormitories, universities and colleges in Virginia, close it down for fall semester 2020. Because as of now, this is not showing anything that's going to slow down to the extent that it's going to stop by September. So be smart, send out congratulations, you're accepted at Virginia Commonwealth University, UVA, University of Virginia, College of William and Mary. congratulations on your achievement. We are planning to have online instruction due to COVID-19 because we care about you and your family and your community where you are. We don't want to be the one that participates in spreading COVID-19. So we want to be responsible and protect your community so you can continue with your education after graduating from high school from your home. And when it becomes safe for us to open up our university, our Virginia Commonwealth University, we will let you know, and then you can come and to our campus. And one of the reasons why colleges did not close down early, and I think Virginia Commonwealth University was one of these universities that did not close down early enough, is because there's money involved, right? I mean, universities make money through dormitory, through food services. I mean, geez, at Georgetown, lunch buffet in the dormitory is like what? $13. Jeez, you know, who pays $13 for lunch? You could get a foot-long Subway meatball sandwich with everything on it for like less than $6, right? And so, you know, I mean, university dormitory food is overpriced because they're making a profit. The university is making a profit and they're paying workers as well. Now, so obviously, you know, they want to make profit from their dormitory, but these are empty buildings. And if students come and live in the dormitory, then they make money. If no one comes, they don't make money. But what I'm saying is money is not the issue here. Human life is more important than money. And so I am recommending, and you are listening to this program because so you know that I've said this here because you're watching me right now. And I've sent out the tweets. You could go and check my tweets as a public service announcement. I am recommended to all the colleges in Virginia to close down for fall semester 2020, send a letter saying, as of now, the campuses are closed because COVID-19. If situations change, we will let you know, right? I mean, let's say COVID-19 ends because God is gracious and it ends in July. Then they could send out a letter in July saying, oh, there's not a single case of COVID anymore, so we're going to start bringing people onto campus. They could do that. Right? It's not like, you know, they can't do that. So I'm just saying, be responsible. Right now, you need to send the letters out to everybody saying, we're not opening the campus in the fall semester. As of now, if situations change, we're going to let you know. So do the right thing. Virginia Commonwealth University, you have like what? The best nursing program in Virginia, people say. I don't know. Some people say UVA's nursing program is better. Some people say George Mason's better. I don't know. But you know, all of you have nursing programs and public health schools. You should know better than act that way. Anyway, so I'm recommending do the right thing. Close the schools down for the fall, at least the campuses, to online learning. You know, I was kind of upset that Georgetown closed down initially. I knew that it was necessary because for public health, but I had a debate plan. You know, everyone, all the politicians who are running for Virginia 8th District, U.S. Congress, I reserved a room at Georgetown, the best room at Georgetown in Healy Hall, Gaston Hall. It's like where President Obama speaks. You know, President Clinton spoke there, Hillary spoke there, you know, leaders of the country, they spoke there. So I reserved the room at Gaston Hall for a debate of all the candidates for U.S. Congress in Virginia's 8th District. And, you know, I was looking forward to, you know, it's not easy to reserve the best place at Georgetown University. And Georgetown University is highly respected in the political world. And I reserved the best place for this kind of debate. So I was hoping that I could do it. And then, you know, I couldn't do it because the whole campus shut down. So I had to cancel the event. But yeah, but still, public health is more important. As much as it is important for me to have this debate of all the candidates for running for U.S. Congress in Virginia's 8th District, what's more important is that we protect lives, and closing down the university is the right thing to do to protect lives. So yes, I was disappointed on one hand because it's a good opportunity to debate and win debates, and I'm confident I could win debates with all of my candidates. I'm hoping to beat Don Beyer uh, on November 3rd, 2020, and become the U.S. Congressman. Don Beyer is the current U.S. Congressman. He's a Democrat, and I think his Virginia District 8 office is in Arlington County. But anyway, yeah. So, but you gotta do the right thing. And so, George Mason University, VCU, UVA, Old Old Dominion University, go blue. You have to close it down. Close it down for public safety. So I speak as a leader to help Virginians, and I hope that you care about Virginians as much as I do, and you will close it down. So just watch feverishly. You can write to your universities if you have children who can accept it to VCU, UVA, ODU, George Mason University. You should write to them and say you should close the campus down for the fall, right? If you're parents, right, you should care about these things. So write to schools where your senior students from Arlington County schools, Alexandria public schools, Fairfax County public schools, Falls Church public schools are accepted. Write to your school and say, please close the school down for the sake of public health. And you could spend 1 year more with your children. I mean, that's great, right? And you will save tons of money, right? I mean, dormitory costs, I think dormitory and food combined is but anywhere from like $6,000 to like $12,000 a year. You want to save that money. And you need that money because many of you are fired or laid off from your job because of COVID-19. So you need that money. And so, so write to your universities and participate in creating public health in Virginia as citizens. Now, the third article is multiple states see deadliest day since beginning of COVID outbreak, and that's today. Today represents the deadliest day for some states. And look at the list of states that it represents. Now, Louisiana is far away. Some of you maybe have children going there for college, so it's relevant to you. Maybe you're from Louisiana. Maybe you have relatives or friends in Louisiana. Now, New Jersey is closer. I mean, in my program, Clinical Nurse Leader Program in year 2020, we have several people who are from New Jersey. So I'm concerned. I'm hoping that their relatives did not die, or will not die. But it's possible. It's the deadliest day today. It's probably going to be worse tomorrow and next few weeks. So, some of my classmates may have relatives or friends, boyfriend, girlfriend, school friends, neighborhood friends die. I mean, unfortunately, that's what happens, right? When people die, they are brothers of someone, sisters of someone, mothers of someone, father of someone, husband of someone, or wife of someone, right? They all have people who love them. And so when you have friends at Georgetown, and my classmates, whom I love, they're from New Jersey. Some of them will have relatives or friends die from COVID, and that's sad. But it's not just New Jersey. Look at Maryland. Maryland is close. A lot of people go to Georgetown, work at Georgetown from Maryland. They're the deadliest day today, and it's probably going to get worse and worse. I mean, who knows? Maryland could become like a Louisiana or Michigan or even New York. We just don't know what's going to happen, right? And you may have relatives in Maryland. They may die from COVID. It's possible. And look at this. Washington, D.C. had their deadliest day. And President Trump said a few days ago that, several days ago, that Washington, D.C. and Philadelphia may become like New York, or at least the White House representative said that. And it seems like the prophecy, quote, prophecy with small p, is coming true, because look at this, Maryland and Washington, D.C. see deadliest day, which means now they're starting to peak. And Washington, D.C.'s Mayor Bowser said it's going to peak in June, which means death rate in DC is going to keep rising until June. So if you work in DC and you have relatives of DC and friends in DC, and everybody in Virginia's 8th District have friends and relatives, people they know in DC, you're probably going to have somebody you know die as this death rate continues. And they said Virginia will start rising as well. And so, I mean, it's everywhere. All 50 states have COVID. Obviously, it's not as bad in certain areas. It's worse in other areas. And so this Washington, D.C. area may become like New York. We just don't know. But it's definitely possible. I think back to like happier times. You see there among the pictures, Georgetown University School of Nursing and Health Study. That's my school. I'm doing my Master of Science in Nursing, graduating in summer 2020. I went to the fall ball in the fall, and I have so many good memories from there. I just think about the ball, and it just kind of brings a smile to my face. It was filled with so much hope and promises. It's one of these happy memories you have. And I actually wrote columns for the Hoya on healthcare. And you can read my articles on complementary and alternative medicine, Chinese medicine. So I've written these opinion columns for the Hoya, which is the school newspaper at Georgetown. And the Hoya is having their big centennial ball, or they were planning to have it. And it was I think it was sometime this month, and it got canceled. I had a ticket to it. I was happy, looking forward to going there and celebrating. And a lot of people were, and it was canceled. So that was a little sad too. But the fall ball, was one of the major, exciting events in the fall. And I was hoping to go to a lot of exciting balls this year. But a lot of them are canceled. For example, APACs, Asian, the APACs, which is it's an acronym. So it's Asian Pacific American Institute for Congressional Studies. They have a ball too, and so I had tickets for their ball in May, and that got postponed till September. It's a once-a-year thing, and all the Asians who are in U.S. Congress come. So I went to the ball in 2019, and everybody was there. Kamala Harris was there because she's part Indian. Bobby Scott from Virginia is partly Indian, I believe, and Ted Lieu from California. Most of these people are Democrat. I don't like the Democratic Party, and I shared that with you yesterday because they legalized marijuana, and I think it kills and destroys the future of children. So I really don't like the Democratic Party and what they do. But I like these people like Ted Lieu and stuff like that. But they come, and hopefully I'll be going as a congressman in the 2021 ball. So vote for me on November 3rd. As you can see, one of the big issues that I support is healthcare. Partly because it affects so many people's lives. Like COVID-19 kills, right? It kills thousands. 2,400 Americans are dying every day from COVID-19. So for me, I care that you don't die, your children don't die. And that's why I'm calling on all the universities in Virginia to take the active step to do the right thing to protect lives of Virginians and others who may come from other states. Close the university down for fall, the buildings, and then have online learning. They could prepare now. They could have an awesome program in the fall if they start preparing for that right now. But if they tell, they're planning to open it up, then nobody's going to prepare for online learning, and then they're going to have not a very good program in the fall. I mean, they got to tell the professors, we're going to have online learning, start preparing now for your courses, and so they can prepare and practice in the summer, you got to give professors time to prepare so that children who are learning online from home can have an excellent education in a new platform. And teachers talk about this as a new literacy. As you know, I'm a literacy expert. You know, I'm a reading specialist. I've done advocacy for literacy in U.S. Congress with other literary experts from National Council of Teachers of English. We do once a year, all the reading specialists and literary specialists and teachers and professors gather together in Washington, D.C. for 2 or 3 days of lobbying or advocacy. And we try to push legislation that helps literacy. So I've been doing that for several years. I was supposed to do it this year too, but you know, they got canceled because of COVID-19. So you know, I care about excellence in teaching, right? And in literacy education, we talk about new literacy. So we've been trying to encourage use of online learning and online tools as new literacy. So the old literacy or traditional literacy is like book that you read on paper, but now we can use resources in the internet to advance different types of literacy. So we talk about that as new literacy. So I've been kind of pushing that for a while. And if you see the program from yesterday, I try to encourage you to use this new literacy by trying ethnic food and then having your children, giving your children like a project-based learning. That's what the technical term. You create a project and then you give them tasks or things to do so it'll be enjoyable for them. They're kind of doing a project while they're learning. So I suggested yesterday that you have ethnic food and then give every child like a city in the country where the ethnic food is from to research online and then kind of give a presentation. You could see yesterday's episode for more details on that. So I'm trying to give you some ways to encourage new literacies. But in order to perfect that, you gotta give teachers and professors time to prepare for fall semester. So I would like to encourage Arlington Public Schools, Alexandria Public Schools, Falls Church Public School, Fairfax Public Schools also to start preparing for online education for fall semester because COVID is not gonna die down and there's no vaccine in sight. So you gotta start preparing now. So you have to tell all of your teachers. I taught at Wakefield High School, which is a high school just like a mile from where I live in Arlington County. It's ethnically very, very diverse. I taught ESL students. I had students who couldn't speak a one word in English. I taught them algebra, math. It was hard, you know, but I'm an amazing, awesome teacher. So some of these students could not even add, you know, -4 plus -4 -4. They couldn't do it at the beginning of the class. By end of summer, I taught summer school there. These students couldn't even speak a word of English. Were getting 100% on my 12-page. My math exam was 12 pages long. I bet, like, you know, during normal school year, you know, I taught at, you know, I'm now a full-time nursing student in master's program at Georgetown University. But I taught fifth graders at Savoy Elementary School in one of the roughest neighborhoods in Southeast Washington, D.C., Ward Dane. And during summer, I taught at Wakefield High School. And my Algebra 1 exams, I gave an exam every week, Friday, 12 pages long, 12 pages. Can you imagine how hard that exam is? I bet like during even the normal school year, students did not even get exams that hard. And I gave these hard exams to students who couldn't even solve the problem, -4 -4. They couldn't even do it. By end of summer, they were kicking, you know, serious butt. I mean, to use a colloquialism, that's how good of a teacher I am. I can bring a student with 4th grade education just out of the boat from, or not boat, you know, they're, you know, however they came across here. Maybe they came on a plane, they came in a car, who knows? But whoever just came from here, from Ecuador, San Salvador, Honduras, who couldn't do any math. Some of them didn't even go to school properly in their home countries. They come to me, the ESL teacher and math teacher, because I'm licensed in both in state of Virginia. And I teach them math, and they could do Algebra 1 better than students who've gone through Arlington public schools from kindergarten to ninth grade with parents who are PhDs working for the Pentagon and the State Department, because I'm that good of a teacher. I'm an amazing teacher. And so, so I wowed a lot of the math teachers in Arlington County because of the miracle that I performed with ESL students who couldn't, and get this, they can't speak a word of English. Can you imagine teaching difficult algebra operations to students who can't even speak English? And I don't speak Spanish. I am an ESL teacher. I speak like many, many languages, but Spanish isn't one of them. You know, French, German, modern Hebrew I speak without any problem. Korean, but you know, most of my students were Hispanic from like Honduras, Guatemala. I can't speak Spanish. Can you imagine how hard it was for me as an English of second language teacher not speaking Spanish to teach Spanish speaking teachers, students who couldn't even solve -4, -4. They couldn't even solve that when I started teaching them. But I'm a miracle worker. And some of these students were getting 100 on my 12-page math exams. That's how good of a teacher I am. I'm just amazing. So, you know, not to blow my own, I'm just, proof is in the pudding, right? As Eminem says. And what I did in Wakefield with these ESL students, I changed their lives. I mean, they're going to become like senators, you know, 20 years from now, because I'm such a good teacher, you know. But anyway, yeah, my students become great. They call me the kingmaker. Students who learn from me become great. Just, you know, whatever I touch turns into gold. You know, if I teach like ESL, you know, I revolutionize the field. If I touch like mathematics, I revolutionize that field. If I teach like English, I revolutionize that field. You know, I'm like the Leonardo da Vinci of 21st century. But anyway, that's why you should subscribe to this channel and tune in every day and watch this COVID-19 update by Heerak program, because you're going to learn something. Even those of you who may have 2, 3 PhDs, you're going to learn something. And so you should definitely tune in and let your friends know, help them to survive COVID as well. Anyway, this is Heerak Christian Kim, independent candidate for U.S. Congress in Virginia's 8th District, who created this program to help you and your family and the state of Virginia. And so I hope that you will share this channel with your friends. And I hope that you and your family and friends will be well. I want you to survive COVID-19.